All right. Well, I'd like to thank everybody for joining us today and definitely thank Dr. Lesley Ogden and Dallas Hull for joining us today. So Dr. Lesley Ogden, if by chance you don't know her, I'm sure everybody does, but she is the CEO of both Lincoln City and Newport hospitals. And Dallas Hull is the laboratory manager for North Lincoln, Samaritan North Lincoln Hospital here in Lincoln City. So, Lesley, can you unmute yourself? There we go. All right, so, we've had so many questions, and like we were talking about, we can never have enough information in this COVID era. So I wanted to just bring you on again because we've had you early on, but so many things have changed and there's other information that we need to get out there. So do you want to just kind of give us an update on what's happening at the hospital at this point?
Yeah, happy to. I guess I should back up and say that just at the end of May, we were living sort of in a nice bubble with, I think we said May 28th was, we had 10 positive cases of COVID-19 through the county, and we were, I think by and large doing very good with social distancing and mask wearing. Quite a few people were doing that. And then we had the subsequent, I guess, the sequela of what happened over Memorial Day weekend, meaning later that week, we had, as a result of family gatherings and parties and things, we had a handful of people, getting closer to about the 20 number, of folks who were positive. Most of those were folks who had attended the same events and who, who had family gatherings and did not, participate with social distancing and masking at those sorts of events. Then we had last weekend, and what had occurred there is we had an employee at Pacific Seafood who had tested positive for COVID, and then there were some worries that because of the nature of how folks work in a fish processing plant, and the fact that some of these folks travel around and travel together and live together, that there was some increased risk. So there were some additional testing done by an outside company at Pacific Seafood. And then over this last weekend, we got the results that showed 124 positive results, I believe, in total out of the almost 400 folks that were tested there. So that really raised our numbers. And then over the subsequent days, we have come up to a total now today of 157, if I'm correct, for the county. At least that's the number we're all agreeing on today. So I guess the thing that has dawned on us is I think there were a lot of us who thought we were going to escape, having a number of folks at the time have this. We thought, oh, we're small enough, we're doing all of the right things. And I still think to some degree that is true. In the big scheme of things, 157 positive cases is not a huge amount. When you're talking urban areas and things along those lines. But for our small community, this is sort of a wake-up call. Like, wow, COVID's out there. It's really there. We were starting to get that after Memorial Day weekend, though, right? That the feeling that, if we let our guard down, this thing can spread. But now we've really started to see it spread quite a bit in the workplace, anyway. So now we are in a different sort of reality. We have now had at the hospitals our first positive inpatients, and of course we've cared for patients who have tested positive in the ER setting or in the urgent care setting or in our drive-through locations, but This was the first in both of our coastal hospitals that we had inpatients, and that means patients sick enough to need hospitalization and spend the night. And so that is another milestone for us, and certainly has changed our world, meaning that, you know, we've now joined the club. We're not going back. Now, has it changed our day-to-day world too much? I don't think so, because we now evaluate everyone who comes in with respiratory symptoms as being positive for COVID. I mean, we have to, right? Because we have to protect ourselves. So if you come in with respiratory symptoms, and we're evaluating you, whether it be in the ER, the urgent care, you know, even in a clinic setting, you know, we're pretty much in full personal protective equipment while we're evaluating you, and we're also asking, you know, everyone who visits one of our facilities to likewise mask themselves and protect both themselves and us from them, because we do know that this can be spread asymptomatically or pre-symptomatically, right? Before people actually start to develop symptoms, there is the thought that they could be spreading the virus then. So, so as far as operationally, this hasn't changed things that much for us. We have not seen a big surge in our ER visits. We have seen more people seeking testing, though. People who believe they have come into contact with someone who may be COVID positive. We're trying to get the right guidance out to people, that the right thing to do is, if you believe that you have had a significant contact with someone who has tested positive for the COVID virus, the right thing to do is not run and go get tested. The right thing to do is to go home and stay home for 2 weeks and do not share this with anyone else. Chances are it won't change what you do, meaning if you run out and go get a test and you're positive, then you'll still be at home for 2 weeks. If you run out and go get a test and you're negative, you still could be positive later. You still may not have enough viral count if you're infected to show up positive, depending on when you came in contact with a person that was positive. You may not have had enough contact to actually have picked up the virus, but if you believe you have, the right thing to do is to go home, protect yourself, protect everyone else, and then the public health folks will sort all of this out as to who has had, you know, a significant enough contact, you know, to continue at home or to warrant, you know, any testing for any other reason. But, you know, that's the getting the word out is what is so tough right now. And so some people are showing up at the hospital, they're asking to be tested. We're trying to give them the right guidance, and helping them understand, you know, if they do need a test, how the right way to go about getting a test, and the importance of staying at home ultimately. So that was a long introduction. So I hope I gave enough information there about our current situation and how things are working at the hospitals.
All right, thank you very much for that. So Dallas, let's go ahead and hear from you a little bit about your role in all of this, what the laboratory does, and then we've also got a testing question that I'm assuming would go to you.
Oh, sure, Lori. So what we do with the laboratory is we're the ones that actually help to assist in providing all the testing supplies, the collection supplies, and also performing the actual testing at some of our sites within Samaritan. We do field a lot of questions in our outpatient areas like our draw station as far as how do I go about getting a test, and I know that we'll probably touch on that topic a little bit during this conversation. You know, and really what I would say is that that's a conversation that really is better with you and your provider. You know, if you have a situation where you're not too sure if you've been exposed or you have some symptoms that you feel might be worrisome, a conversation with your healthcare provider is really the best first step. You know, via phone, maybe have an opportunity to schedule an in-office visit if necessary, but again, initiate that conversation with your provider. The other things that are really critical at this time is to make sure that we're practicing all of the appropriate steps to try to help with prevention. So social distancing, mask utilization, whether it's face covering or more of a procedural type mask when you're out in public. If you're not able to social distance, it becomes critical and key that we are wearing masks. And as Dr. Ogden touched on, whenever we have patients or visitors that come into our facilities, we ask that they do have face coverings on to help protect everyone that's around them. So again, just to kind of emphasize that point, that it's benefiting everybody else around you, not just necessarily you yourself. And it's kind of the right thing to do, the polite thing to do within our society. In addition to that, we also want to make sure that we're practicing hand hygiene. And so when we have people that come into our facilities, before they leave and when upon entry, we ask that they perform hand sanitizing with an alcohol-based hand sanitizer, or that they wash their hands. And again, we're trying to help ensure that we're not spreading anything from an asymptomatic person. We have a lot of people in our community, and unfortunately there are going to be those that are asymptomatic and that potentially could be spreading COVID unknowingly. And so that's why practicing these good social habits are really important. As far as the laboratory testing and the laboratory side of things, we do have centralized collection locations for Samaritan, and here in Lincoln County we have two. We have one in Walport area, and then we also have one in Depot Bay. And both of those are ones where if we have patients that have been determined to be symptomatic and the physician orders testing, then that is something that is scheduled with the provider's office to help them determine that that would be the proper location for them to go. So again, patients that go there for collection would need to have a doctor's order first. And then at that point in time, they would be instructed where to go to get that collection performed. And it's a drive-through collection similar to what you probably have seen on TV, where you come in your car and they do everything through your car window, but again, with a provider order. And then in addition to that, we're starting to see, and that would be the nasal swab testing that you've seen so much probably on the news already. They're starting to come out, and we actually do have some availability with the antibody testing. The antibody testing is really to help determine if you've had a past exposure and if you've formed some form of an immune response. And so the way that this is kind of being utilized right now, if we have patients that have concerns about a past exposure when the testing was not really all that available, again, through a dialogue with your healthcare provider, it may be something that is warranted to go ahead and have that test performed. But the caution there, and the really critical piece of information to have, is that just because you formed an immune response, we do not know enough about COVID right now to know if that offers any level of protection whatsoever. So that's why it's very critical that even if you think that you've been exposed before and you've been tested and it's been positive and indicated that you had an immune response, there's no level of protection that that's offering you, and you still have to practice all of the social distancing and the other standards to try to help with prevention. In addition to that, we also will see some patients that are required to have some of the asymptomatic testing for procedures, and that would be testing, again, that would be arranged through your provider. So I hope that gave a little bit of an overview of that.
Yes, great. Thank you very much. I've had quite a few calls here at the chamber asking about the cost of the testing. Can you just touch on that?
So as far as the cost of the testing, it's really going to depend to a degree as far as where the testing is performed. I can't speak specifically to cost just because, again, there's a little bit of variability there. And what I would recommend is that if you have questions, direct questions about cost, it would be really helpful for you to contact the laboratory or the hospital in general, and we have lines within our business department that can help provide you specific cost information, and they would be able to provide that tailored to your particular situation, because you may have insurance that would be covering costs, and if that's the case, then again, they can kind of give you an idea of what that impact would be for you personally.
Okay, great. All right, so our first question is for the local commercial fishermen. They've been designated essential workers, but they cannot follow CDC guidelines on social distancing while working. So they've been advised to get COVID-19 testing prior to fishing trips. Additionally, many may have been inadvertently exposed through the Pacific seafood outbreak. What do commercial fishermen need to do to get tested? What is the cost of the testing, and will they be expected to pay for that themselves?
So I can touch on a little bit of this. With regards to the commercial fisheries that are in Newport, prior to them at the beginning of their season, there was arrangements made with the county and with the state to help assist with them getting tested so that they have a baseline test. Again, because they're not able to practice social distancing, they're in very confined quarters, and there's some challenges that they face because of the industry that they're in. That was something that was taken early on. Now, as far as where they are at this point in time because of the outbreak that's occurred at Pacific Seafood, that's something that the contact tracing process will help to kind of determine who's had unprotected contact with known positive patients and what additional testing might be needed. And again, that process would help to kind of drive the additional testing that may be required.
So just a quick follow-up. I'm the local Sea Grant agent, and I have gotten nonstop questioning about this. So just so that I can return to the people I represent with good answers. Most of them do not have health insurance. They're not employees, they're contractors. The testing that was done earlier was for one specific industry, not all of the different industries in commercial fishing. It's mostly Pacific whiting because those are the largest crews, but the crews that are going out now are much smaller. They all sleep in the same room. There's no way to do any sort of social distancing. And so there's concern. We have been provided with a letter that says they are authorized to get tested, and they have that. But we're just really trying to figure out, because in Clatsop County, the county's paying for all commercial fishermen to get tested. We're just trying to figure out if there's any plan to do anything similar in Lincoln County. And if not, for people without medical insurance, because most of these young fishermen do not have medical insurance, how they go about getting tested and what the cost of them might be.
So the one thing that I would probably say with response to that would be, it's something that's going to be coordinated at the county level through the health department. And so what you really want to do is coordinate that with your local health department. The testing that is performed when it goes through the county is typically performed at the state testing laboratory. And I believe that with a lot of that state testing, there is not a cost associated with that to the individual or the end user. However, that's something that, again, would be part of that conversation and coordinating that with your local county health department.
All right. Did that answer your questions, Angie?
No, but we're also reaching out to the local county health department, so we'll see what we can figure out. Thanks.
Right. Okay, so next question, either Lesley or Dallas. I have a retail business and my employees and I are wearing masks and shields. Is wearing both overkill, or is one better than the other? My husband was at OHSU yesterday for an office visit and all of the personnel there were only wearing masks. I don't want to overdo it, but I'm confused as to the most efficient way to protect ourselves.
Well, what a timely question, because we are actually going through some of the same sort of logic issues. What has happened with us is that we have had a universal masking policy for some months in place now. And that has worked very well for us. However, we recently have had some exposures to folks who were COVID positive that we were not aware of, either because they came through with no symptoms at all, or even a negative test initially, and then later a test came through positive. And so even though we were masked, and even though we had appropriate other coverings on, there, because of the nature of the interaction in healthcare, you're close to each other, you're sometimes performing procedures, you're in conversational contact with someone for an extended length of time. We felt that those people did have some risk of the possibility of contamination through their eyes. And so what we are evaluating now, and we'll likely get to probably today, is asking all of our clinical workers to wear some sort of eye protection when they are interacting with patients. Anytime they're closer than 6 feet and have those patient interactions that in addition to masking, they also need to have eye protection. So if you take the argument that that public health is using, that a significant contact, meaning something that could possibly spread the virus, would be a face-to-face conversation of about 15 minutes or more, or any closer contact. Certainly if you touch someone, if were closer to them, but just, public health is trying to determine like what is a risk of infection, and that's sort of the criteria they're using. If someone was in an industry where that was true, where you would have a sustained conversation with someone for longer than just a few minutes, that maybe it is worth consideration that eye protection may likewise be necessary. In healthcare, because we're dealing with sick people, we know that it's more likely that we will see those sick people, and we want to protect ourselves even more. I think, different industry would have to make that that determination for themselves based on the type of interactions their employees might have with customers. And could they, if you can preserve a 6 foot social distance and mask yourselves for any time you just happen to bypass somebody closer than 6 feet, for very quickly, then that may be absolutely perfect. But again, if you have closer contact, if you have conversational contact that that could be unprotected, then yeah, eye protection may be the way to go. And I think what you'll see is more and more healthcare institutions will be moving in this direction for eye care protection as well. Dallas, did you want to add anything else?
Oh, I would agree with everything that you said. The only thing that I would add to it is that just to kind of emphasize that it is somewhat industry dependent. And if your work does require you to become, to have prolonged exposure and closer than 6 foot intervals, and especially with touching and stuff, that's something to definitely consider. Oregon Health Authority has some really good recommendations that are industry specific on their website. I would definitely start there first whenever trying to put together some sort of a plan. But if there's something that you see that's unique about your business that's not really defined in that recommendation or that guidance that's offered by Oregon Health Authority, I would seriously consider maybe adding something like that to your plan.
All right, Barb, did you get your question answered? Do you have any follow-up questions?
No, I don't. I think that's adequate. I just, do you think that I think if I have one more question, it would be if the clear protective glasses that you can get like at the hardware store or something, that for over your glasses or over your eyes, would that be adequate to or equal protection to a shield along with the mask?
That is what we are considering right now. We're making our policy to say you can wear this, or you can wear this, or you can wear this. What is equivalent? And we are considering goggles, face shields, and some other types of glasses, with the side components to be fairly equivalent as far as just protection from droplet types of transmission that might be in the air from conversation. So yeah, there's a lot of equivalent types of things that I think would perform as well as each other. We've considered that the most important issue with asking employees to do this will be their own comfort. The thing that will make an employee be less likely to wear eye coverings will be if something is uncomfortable or fits ill-fitting. So I think the best thing we can do if we're providing this for our employees is, definitely give them all the right reasons and make sure they understand why they would be wearing this, and then provide them something they're comfortable with within a range. So for example, if someone already wears glasses, they may be just fine with goggles that fit over those glasses, or they may well prefer a face shield, in that scenario. It's just whatever is most comfortable, I think, for them will inspire them to wear it properly and appropriately.
Okay, well, thank you. I gave them the option yesterday of whichever one they're okay with. I will allow them to wear. And one person just didn't like the shield too much. It's rather uncomfortable for her. So thank you very much. I appreciate it. And thanks for all the time you give to us, Lesley.
Oh, you're very
Great.
welcome.
You're great.
All right, just one more quick follow-up on the PPE. Has anyone heard anything further regarding PPE being distributed to the fish processing plants? Yeah, I haven't. I don't know if anybody could answer that. All right, so moving on. Would it be helpful for retail establishments to gather customer contact information on a voluntary basis to assist with contact tracing? If so, what is the minimum information that would be helpful?
Okay, so repeat the first part of that question again.
She's asking if retail establishments should gather their customers' contact information on a voluntary basis.
Yeah, it's certainly recommended that if you can, I think as many records as you can keep. For example, restaurants are being asked to keep that. Various folks that cut hair, that do personal type services, are asked not to take walk-ins, to only take appointments, to only take those people that they can, maintain those records on. I mean, it certainly is helpful, right? Because if you have to do that contact tracing, and by the way, these folks who are doing this job, an initial interview with someone takes 2 to 3 hours sometimes to try to figure out how to recreate your life, for a length of time. And then a contact tracer then works backwards from that to make contact with every person you've come in contact with. And I mean, this is an exhaustive process and a thorough process. And bless their hearts, there's a number of people now who are doing it from public health, but also we have 3 Samaritan employees who have been loaned to public health. There's some OCCC nursing students who have been loaned, and there's even some folks from the tribe who were just all coming together to try to figure out how to get on top of this, because it's so time consuming and you have to be so thorough to make sure that someone isn't missed, along the way. So yeah, definitely any help that that a business could give, if it's possible, it would certainly, may really come in handy and be helpful as far as a public health service, eventually. It just depends on your type of business, I think, as to whether or not you can figure that out and be able to do it.
Yeah, I did go into a restaurant the other day and they had just a clipboard up on a little table in front asking people to sign in, basically, just for that purpose. All right. I had a question that I've gotten here at the chamber too. Can I contract COVID-19 from a package in the mail?
Boy, that's one that shows up quite a bit in online and in social media debates and everything else. But I think the science, number one, we don't have a lot of science. I mean, nobody's sitting back and doing a lot of testing, although they might be by now. But initially, we didn't have, you know, a bunch of scientists who were swabbing the surfaces of packages and, you know, letting us know the outcomes. So what we're seeing is a lot of educated guesses. And I think now we're starting to see some of the first science behind this. But while it's possible, it's not probable. And we do know that the virus does not adhere to, it doesn't, number one, it doesn't do well outside the body. It doesn't do well in UV light, you know, sunlight. It doesn't, the virus itself does not live robustly outside the human body. But it does depend on what surface it ends up on as to, you know, can it last longer? I think everything that I've read has said that if, again, it's possible, but it's not probable. It depends on, you know, you'd have to have like an infected person who touched your mail, you know, at such and such a time, and then it got to you and you touched it, and there would have to be enough viral load, you know, like maybe a cough onto it, or, you know, you can make up a scenario in which this could possibly occur, but is it probable that it will? You know, most likely not. But if you're worried about it, from the beginning, I've had a station in my garage where all mail and packages go, and I handle them out in the garage, and then you take everything, you know, into the house after you've taken it out of a package or whatever, and washed your hands, and, you know, it just alleviates the issue. The other idea is you could let it sit a few days, and you know nothing's going to be living on it that way. And then you just pick it up and take it to the house then if you're at all worried about it. But I think until we have concrete scientific data, it's going to be tough to you know, say this is absolutely, you know, until that study comes out, we're not going to be able to say it. Dallas, would you say anything else? Any different?
The only thing that I would add, I would fully agree with everything that you said, is that using kind of a universal precaution approach where after you handle mail, wash your hands, use an alcohol-based hand sanitizer. If you have concerns, don't necessarily handle it within your home. It is a respiratory virus, and so living on a surface, while it may be viable on a surface, as long as you're not either licking the package or handling it and then touching your mouth, it's going to be difficult to transmit it to yourself. But good common sense practices as far as hand hygiene is a great way to help prevent any sort of potential exposure to yourself.
Yep, great advice. Wash your hands after you do absolutely everything, which I think we've kind of all gotten in that habit through all of this. So another question, and maybe it's just kind of an educated guess again, how long are asymptomatic people contagious?
That's a good one. Because are you asymptomatic in your pre-symptomatic state, or are you just asymptomatic and you just never had symptoms? I don't know that I have a definitive answer to that question, but what we're using now is for symptomatic folks, you know, obviously is the 2 week, you know, that we're saying that you should form symptoms if you're going to form them after an exposure within that 2 week period. And then you have a period of symptoms, and then you have your recovery after that. And, you know, I just cannot say, like, would this all play out if you were completely asymptomatic, because we don't have those studies of asymptomatic people. We have anecdotal information about asymptomatic spread in a lot of cases. For example, there was a gentleman in China who did some travel to Wuhan early in the pandemic, he came back to his home and was asymptomatic. His wife, shortly thereafter, came down with an illness and was hospitalized in the local ICU. Later, they went back to him and performed an antibody test that did show that he was exposed and had formed antibodies. So the theory was that he was asymptomatic and that the spread came from him to her, and that was the pathway. So I don't know that we have enough science yet to say exactly how everything works with asymptomatic folks. Dallas, do you know any more?
No, I would just echo everything that you said and then just reemphasize the fact of the importance of us practicing those good habits socially, because we really don't know that much about this disease. And the asymptomatic carriers are the ones that I think are probably most concerning, just because they kind of are in the population somewhat in disguise, and we definitely have to be aware of that. And unfortunately, we don't have good information.
Yep, that's kind of what I figured. We're just out there. We don't know. All right. Well, that's all the questions I had. Does anybody else? Go ahead and unmute yourself if you want to ask a follow-up question or another question. Gordon, did you have a question?
No, I'm fine. I'm just listening in. Thank you.
Okay.
Lori, there was one other thing that that I think that's important to clarify is that previously, as far as testing goes, we had and we still do have guidance on who's appropriate for a test and who's not. We still do not have enough tests to just go out and test anybody at any time. We have to be very realistic that we do not have stockpiles of millions and millions and millions of tests. So we still do use guidance, but our guidance now includes some asymptomatic people. And so we are broadening testing. We still require that a doctor give the order that it's appropriate to test you. And this is through Samaritan. So I do want to clarify, this is a little bit different than the testing that public health may do, because if public health does it, they do it by their declarations and from a public health standpoint. We're doing it by individuals. So if an individual seeks a test, we have guidance, and now the OHA has updated their guidance to include asymptomatic individuals that, for example, have been in close contact of a person with a laboratory confirmed, COVID-19 test, people exposed to COVID-19 in a congregate setting. That's like a residential care facility or, something like that. We actually do include on that list migrant and seasonal agricultural workers, upon arrival in Oregon. We also include some racial sorts of recommendations, people who identify as Black, African American, Latino, Latina, Latinx, American Indian, Alaska Native, Asian American, or Pacific Islander. And that's just based on risk factor, and that the folks in these categories are suffering, a higher risk of complications from the disease. Clearly, if someone is needing a test and feel like they meet these qualifications, the qualifications are broader than ever before to get a test. So it's just something, it will become broader and broader. We do want to get to the day where you can just say, I'd like a test. And that be an appropriate answer be yes, but we're not quite there yet. We still do have shortages, and we still have to work through, appropriate conservation of testing resources.
Well, and you hear on the news that, you know, if you've been part of any of these protests going on, you should go get tested. So are there certain areas that you don't need a doctor's order, that you can just go there and get tested? And do they also verify your permanent address to get tested?
My understanding is that in different states, things work differently. So maybe Dallas can have some more insider information in this, but I've actually been asked by a number of people, like, why does testing work different, you know, in California than it works in Oregon? And I think a lot of it has to do with us not being hotspots. You know, things were routed to hotspots initially, and they got more resources. I think also we don't have big population centers quite like some other states have, and we only have 4 million people in our states. But I don't know, maybe Dallas has more information on that.
So I can only add just a few things to that. Again, because FEMA got involved in some of the distribution of some of the critical resources, whether it be the collection supplies, the testing supplies, as Dr. Ogden had mentioned, those are going to hotspots like whether it be New York or California early on when they were hotspots. So unfortunately, areas such as Oregon just did not have the resources to perform testing. Early on, Oregon Health Authority kind of had the sole ability within the state of Oregon to perform testing directly, and they were able to offer about 80 tests per day early on in this epidemic or this pandemic. And there was some of that was duplicative, which means that they had to do some confirmation. So just to say that we had to be very good stewards of our limited testing resources in the state of Oregon, which kind of created this protocol that we currently have. Where other states, it made more sense because they're managing it on a state-by-state level. It made more sense for them to have a lot more broader testing, because either they were experiencing major outbreaks and they were trying to determine recovery, and the availability of, we'll say, an antibody test just was not there yet. And so they had to manage it differently. But because it is state-by-state managed and led, it really does show some differences the way that testing is available within different states.
All right, thank you. So we do have one more follow-up question. For those older with Medicare, are their COVID-19 expenses more likely to be covered as to both testing and treatment?
I would definitely say yes. In fact, every insurance plan has, I think, pretty much come forward and said that they would pay for COVID testing. And then certainly, of course, it depends on what form of Medicare you have, if you have additional coverage, you know, a Medicare Advantage plan, you know, everybody can be so independent and so different as far as their insurance benefits. But by and large, Medicare is a fairly good cover of illness and testing. And so, so I would say in the vast majority of cases, yes, that those sorts of things would definitely be covered.
So how about like private insurance, MODA, for example? There aren't any exclusions for COVID, are there?
No, none that I have seen. When this first started, some payers were a little slower than others to get on board with coverage, but I think now we are way into this, and all insurance companies are covering COVID testing. It just depends, are they covering the full cost of testing? You know, it depends on where it's done. Different laboratories charge different amounts. You know, I don't think I've heard of anything more expensive for an end user, uninsured, without any insurance, that had to cover their full cost of more than about $200 a test. But it can certainly be much less than that, and, you know, depending on your insurance, and sometimes fully covered.
All right. So we've talked a lot about the testing. What, in your opinion, where would be the best place to track the outbreaks?
Track the outbreaks. Can you elaborate?
Well, just to get the true numbers, to keep up on the by
Oh,
the,
if you want to follow along.
yeah, right. Yes, we all do.
Well, I every single day when this first started, every single day I was logging into the OHA website and going to their coronavirus page and that's Oregon Health Authority. The reason I was doing that is because they have the data for the whole state and they pull it all together. They've got a really nice page that summarizes everything. It tells even by county, you know, what's going on. But now, since we've started to see an uptick in our numbers here in Lincoln County, I log in every day to the Lincoln County Public Health website. And that's just a division of the Lincoln County webpage. And then I go to their coronavirus area and check, okay, how many more do we have in the county today? They keep up with the numbers there. They also have press releases every time there's another group of cases. They tend to group them by day. And it gives you some information about who the folks are, meaning not names or anything, but was this community spread? Was this a family gathering? Was this a workplace, you know, sort of thing? So you just have a little bit more information about, you know, what groups are showing up positive and how people are transmitting it. Because you can imagine it's different in a workplace than it is within a family. And so it just gives you that additional information.
All right. Yes, I agree. The county's been doing a great job. All right. Dallas, do you have any follow-up or anything else you wanted to cover?
The only thing that I would probably add to that is that for most people that I've talked to, they find the state website extremely helpful, and to track either daily numbers and updates or whether it be to get additional information and education. Is most of you are, I'm sure, very aware there's so much misinformation out there right now. It's nice to have a reliable source for some accurate, comprehensive, and complete information. The Oregon Health Authority's website really is that first source. It'll also provide you information with updates to CDC guidelines as well as, we'll say, the FDA. So if you have additional questions, sometimes that's a great resource to get those hard to find answers.
Yeah, and Lori, I'll add that since the beginning of this pandemic, so many people had questions about what was happening at a Samaritan facility, like what were our policies and procedures, how were we using our PPE, that personal protective equipment, you know, what were our testing policies, all of that kind of stuff. So what we did was we put our internal website, we just made it public. And so if anyone is interested in that depth and breadth of information, because it's pretty deep, but everything is available at samhealth.org. And you can see the same exact policies that we are working on internally. They're externally facing, so you can see how many times they've changed and, you know, what we're basing our you know, our policies on. You can see, you know, how patients sort of flow through some of our treatment protocols and all kinds of things. It's just a wealth of information. But certainly, I know public health has found it very helpful as they counsel individuals on how to interact with us in Samaritan and how to seek care. They've used that website quite a bit. And so, you know, maybe someone will find that helpful as well. It doesn't have all the statistics and stuff, but it has how we work. And sometimes that's helpful for people. And certainly if individuals are seeking treatment, it has, you know, testing information like, you know, I have a Samaritan primary care provider. Okay, this is what I do. I don't have a Samaritan provider. Here's what I do. I'd like an e-visit. Here's how to get one. You know, those sorts of things. And so it gives you pretty clear guidance on how to get what you need.
Yes, and certainly if anyone needs to visit the hospital, then visit that site first to really be aware of what the protocol is and what you'll be asked to do.
Yeah, and all your options, because if you're just looking for a test, boy, isn't it a lot easier to try to have a telehealth visit with your doctor and get an order rather than trying to go to a hospital and having to mask and having to answer so many questions and putting yourself at, we have to think about it. Every time we go out, every time we interact with people, that is a potential risk. And so if you think you have been exposed to COVID, well, then you're risking every interaction with anybody else as a possible, mechanism of spread. If you are just interacting with everyone else, then of course you're increasing your risk every time you do that. So if you can mitigate that risk anyway, why wouldn't you? And so these are just some ways you can do it. We have so many more ways to use technology now.
Right.
Lori, I have a comment.
Okay.
I've been checking every 48 hours on 3 different websites, Worldometer, NPR, and CDC that MSN Microsoft puts out. And it's hard to get consistent information on any of them. The CDC, the Microsoft CDC, when you come to Oregon, list all 36 counties, you go down the counties. Right now, this morning, they still have Lincoln County. They moved it from 27 cases down to 1 case instead of 157 up. They have Umatilla going from what was 131 down to something like 5 or 6. And they have another county, trying to think what, Benton County went down from 62 down to a low number. So they're totally unreliable up until the Pacific seafood outbreak. Lincoln County, when you took the Oregon statistics, reported cases and deaths, and you added up the counties, were 1-on-1, 100% right. As of the last 6 days, they've been totally messed up. And they, I don't know when they're going to catch up or when they're going to get it right, but they don't have it right now. NPR consistently, or excuse me, Worldometer consistently shows a lot more total deaths and a lot more total cases than we find on CDC. CDC seems to be about 5,000 cases low in the reported deaths on New York, and that's been consistent now for about a month. If you check NPR figures on, NPR figures on the deaths in New York, you get over 30,000. If you check CDC figures, you're down around 24, 25,000. So just to tell you, the information is not always that accurate. I've been keeping it and sending it out to some people because that's just kind of a thing I want to do in terms of keeping a summary. But it's confusing because you run into those situations. That's what I thought.
Gordon, I think you follow it and track it and trace it more than anybody else. So thank you for your reports. But, it's like anything. You check Facebook, there is so much misinformation out there. So everybody just do your due diligence and get the information that is most pertinent to you.
Thankfully.
Great. Anything else?
I think there was one more question.
Oh, what is your recommendation for somewhat discretionary procedure in the hospital setting?
Like if you needed a mammogram or something, yeah.
Yeah.
Well, we're trying to, get the word out that that coming into the hospital is as safe as we can possibly make it. We certainly don't want people to put off healthcare that could affect them negatively later. We've seen a lot of that, especially at the beginning and in the mid-range of this pandemic, when people just stayed home right? And they were just scared. And in many cases, people had their heart attacks at home, they had their strokes at home, and they did not get the care they needed in a timely fashion. And so as medical professionals, that has worried us. Now what's really worrying us is, will those folks come back who need preventive care that might prevent a colon cancer, you know, to have a colonoscopy, or might prevent a breast cancer, to have a mammogram. And so we have just gone that extra step with screenings, with universal mask precautions, with, you know, all of the things that we're doing, socially distancing our waiting rooms, you know, everything that we possibly can come up with to make sure that people are safe when they come into our facilities and when they get tests, because we do want people to get the medical care that they need in a timely fashion. So, you know, I would say for those sorts of things, you know, we have had the opportunity to buck up everything and to get our policies in place, to get our procedures in place. And I do believe it's one of the safest places to go nowadays. And of course, I would encourage anyone who's coming to one of our facilities, remember to wear your mask, bring your mask and wear it. And we're asking that everyone do that. And then likewise, the expectation, you know, as you go around, you'll see everyone else also, you know, masked, and very likely here soon, you'll see them with eye protection, as well as, you know, other personal protective equipment to make sure that they're safe. You'll see people doing extra cleaning. You'll see people, you know, that have definitely rearranged things. You'll see stickers on the floor telling you, you know, reminding you where to stand 6 feet away from people, and all of the things that we can do along those lines. And then, like Dallas said, hand hygiene is one of the biggest. And so you will see just about every 6 feet another place that you can perform hand hygiene, so that's throughout all of our facilities. And people are definitely encouraged on the way in and out to hand hygiene, but anywhere else along the way. And that will keep us all safe.
All right. Well, thank you very much for all of this information, and thank you so much for all that you do, both in the hospital and in the community. I keep saying on my end, I've never worked harder through all of this, and I'm sure the same is goes true for you. So thank you very much for the information. This will also be, that's been recorded, so it'll be on our website as well. All right. Well, thank you very much for joining us, and go have a great day.
Thank you.
Thank you.